Hi, Dr. Song. We are so honored to have you on our show today. You're doing so much good work in this space with pediatrics and children and really promoting lifelong wellness and creating a resistant child. And I remember first hearing you on Dr. Drew Pruitt's podcast, and it was back during the pandemic. I think it was the first episode you did on his show. And I just immediately started following you and subscribing to your newsletter. And I actually remember I went and got one of the antibody tests that you had recommended, which was different from the one that most people were doing. And so when your new book came out, I just reached out, and we're so honored and excited to have you here today on our show. So
Yeah,
thank you
well,
for
I'm
your
honored to
time.
be here. I mean, that seems like a lifetime ago, doesn't it?
Mhm.
Yeah.
And I
Yeah,
can
but
distinctly remember where I was listening to the episode, which is a little
yep.
crazy because I
Yeah,
can't remember
yeah,
what I did an hour ago, but yes.
yeah. But that's where, the message from the pandemic was, okay, how do we create resilience? What does that mean for our kids? It's not just, it's so much from the inside out that we have to work on that. And so, I'm glad that messaging has really come to the forefront in the health and wellness space, that people are no longer thinking, oh, it's not about never ever getting sick. It's about, all right, when life's inevitable bumps happen, do you have that foundation so that you can bounce back?
Right. So before we dive into this conversation today, we'd love to know if you could treat yourself today to one thing and like time and financial constraints were not an issue, what would it be?
That's a tough one. So, I mean, honestly, our most valuable asset is time, right? I
Mhm.
guess I would buy more time.
Yeah.
If I could, that's not possible. But, time, like an extra hour with the kids, an extra hour with Peter, and really probably more importantly, an extra hour just for me, just in the quiet. I mean, as a mom and as a business owner and a doctor, it's hard to find those quiet moments where you're literally just either not thinking at all or just sitting with your thoughts and letting them organize. So I guess that would be it. I'd buy myself an extra hour of time.
Mm.
I think we could all use that,
Yeah.
right?
100%.
Now for someone to be able to invent that would
Right.
be great.
So, Elisa, we would love for you to provide some insights into the pivotal moments and experiences that have really influenced your career and your journey and how you ended up becoming a holistic functional pediatrician and then ultimately writing your book, Healthy Kids, Happy Kids, which I see sitting there behind you for those of you on YouTube. Can you talk about that a little bit?
Yeah, yeah. I think my story is a little different than many conventional doctors who came to this space because I didn't have a health concern that I was working on, where conventional medicine does not really do a great job at looking at root causes. I didn't have a family member with a health concern. I mean, knock on wood, right? I mean, that's not how my journey. And so I really got into it wasn't even called holistic medicine then. It was called alternative medicine. I mean, this was back in the, mid 80s when I was mid to late 80s when I was in college. And I remember walking around campus, here I'm in the Bay Area. So I was at Stanford and just thinking, what am I going to do with my life? I didn't want to be a doctor per se because my mom was a doc. And I'm like, oh my gosh, that life is just crazy. She was an OBGYN and she was never home, delivering babies all the time. But I always knew I want to work with kids. And so I thought, well, maybe I'll be a teacher. I actually went down the path of becoming a lawyer. I wanted to do civil rights law and do children's advocacy on Capitol Hill. And I stumbled upon this sign, this flyer on one of those telephone poles that was a conference of the American Holistic Medical Association at the Santa Clara Convention Center. And I was so intrigued because I had always been interested in spirituality, mind-body medicine, really thinking about how do we incorporate mindfulness into our everyday lives. So I went and my mind was totally blown. I mean, I heard from folks who were really starting to get very well known at the time, like Andrew Weil and Deepak Chopra. I mean, that was, late 80s. It was just kind of blossoming, right? So I remember at that point, I called my mom up And I said, Mom, I think that I want to be a naturopathic doctor. Because I had heard of that term, and I'm like, that sounds really interesting. If I'm going to go into medicine, because I'd already realized if I go to law school, I could serve children and do a really good job by them and for them, but I wouldn't be working with them. So then I was already
Mhm.
thinking maybe pediatrics, and then this was the path that I thought, okay, I could do this. This could be so fulfilling, and that's kind of informed every step of the way. So even when I started med school, when I started residency, when I started my practice, it was always to be more in the natural medicine, integrative pediatric space.
So you went through the traditional MD route,
I
knowing,
did. I did.
knowing, so you weren't trained as a naturopath then?
I wasn't, I mean, my mom, when I called my mom up, she didn't say, oh, not, I don't think that's a good idea. She just said, like, what is that? I mean, curiosity, she would have supported whatever I want to do, but no one in my circle knew what that was.
Yeah.
And so I just didn't get the huge encouragement. What I got was, well, maybe you want to actually, go to medical school and then you could, do that, learn that, So yeah, I went to conventional medical school. I mean, to be honest, I didn't see anything in conventional medical school that I wanted to do, but every year I just kind of plodded along and, there I was in residency. And I actually did create in med school a holistic complementary and alternative medicine section for the American Medical Student Association. I was declined by the deans of my medical school to go to an elective in University of Virginia that was the only medical student, holistic medicine elective at the time with Pally DeLevitt. So I created a little section
Yeah.
in med school, and still with the advocacy. I actually was part of the lobbying and advocacy, and I started looking into, regulations around, what really was then, now we call it integrative holistic medicine, but it was alternative medicine at the time. So, but yes, I went the conventional route. And, to be honest, I'm really grateful for this path because I'm fully grounded in, okay, from a conventional standpoint, what could go wrong? I mean, what are some of the diagnoses that we need to understand? What are some of the emergency treatments? What are some of the things that really, we need from conventional pediatrics to put fires out? But then we need the other part, the functional pediatrics, integrative, holistic part to rebuild and kind of, grow from the ground up. And so, so I feel like, it in retrospect, it was the right path for me.
Yeah. Well, what a great path. So before we dive in and kind of get into some of the specifics in your book more, maybe it's helpful just to touch on the state of children's health today, why we're seeing so many illnesses, and maybe even like, what are those top chronic illnesses that you're seeing at a much earlier age than typically at the, from birth to even, through teenage years.
Yeah. There has been a fairly dramatic shift since even when I was in medical school. Again, I mean, this is kind of a long time ago, but not that long ago in our health history, right? But, I finished my medical school at NYU back in 97, and then my pediatrics residency at UCSF in 2000. So that was, 25 years ago. And back then, eczema was, I mean, yes, it was common, but it wasn't as severe as it is nowadays. And I remember being told by the pediatric dermatology attending, never, ever put anything more stronger than hydrocortisone 1% on the face, right? Over the counter 1%, right? Never, ever put steroids in the diaper area. And here we are now, 20 years is not that far off from then, where we're putting, I mean, just these incredibly strong steroids on the skin. We know everything gets absorbed, through the skin. And I had a little kiddo who, had absorbed so much of the topical steroids that he was in adrenal crisis. I mean, that can happen from topical. When we think, oh, it's just on the skin, it's not going to have systemic effects, but that's not true. And so, and, with such severe eczema showing up at younger and younger ages, I'm seeing kids who are, getting antibiotics left and right for their skin infections, even hospitalized for IV antibiotics and IV steroids, and put on cyclosporin, which is a chemotherapeutic agent. So the fire has gone out of control. Right. I mean, and of course, now the crisis of mental health in our children, and it's we are, if you can't, pick up the paper without seeing another thing about a high school student and incident in high school. And we know that by the time kids are 18, nearly 1 in 2 are going to be diagnosed with some sort of mental health condition. Our teenage girls especially are in crisis. The last survey shortly after the pandemic, life opened up, 1 in 3 teenage girls had seriously thought of suicide. And so we have that, but then we can't just start with our teenagers. We have to realize, you know what, that stage gets set when they're much younger. I mean, we have 8-year-olds going to the ERs with suicidal ideation. And so when we can understand, the foundations, the roots, and start when they're young, or even if you have a teenager now and you're like, okay, I see that the root was maybe started when they were a toddler. What do I do now? We just have to understand what those factors are so that we can move forward and help our kids. Even our metabolic crisis, so many children are not metabolically well. And this is even, the teenage, female or male athlete, this is the fit, slim, strong, lacrosse player or, tennis player, whatever it is, and they are not the picture of someone with type 2 diabetes. And yet I will check a fasting blood sugar, I'll check a fasting insulin and see, oh my gosh, that like on the outside, they look really fit and slim. On the inside, they have a prediabetes body. And so, these are things, the reason I point these out, I mean, especially with type 2 diabetes, when I was in med school and residency, it wasn't called type 2 diabetes. It was called adult onset diabetes. And we had to change that. Juvenile diabetes was the type 1 autoimmune, and only adults got the type 2 lifestyle related, diabetes. And now we're seeing younger and younger kids and kids who are not the typical overweight, sedentary, kids. They are kids who are active, but there are things that, in their diets that we can tweak and really help to modify. All of these things to say, if we understand the root, we can modify it, right? We can take that power back.
And some of that, I'm thinking about how you mentioned the teenagers and the mental health issues and the skin issues. And I don't want to say it's too late because it's never too late, but
Yep.
it really starts with the parent, right? Like educating. Do you find that you're educating parents a lot? And I feel like it has to start at a very young age, right? Because if
Yes.
you're, I'm just thinking about birthdays or sports when the kids are little and they get the fruit snacks at the end of every soccer game, or the birthday parties where there's the cake and there's the goodie bag and there's the candy and all this
Yeah.
stuff. It's like we have to change as a society and as parents, our whole frame of reference so that we're raising kids to be healthier all around.
Yeah. I mean, 100%. I mean, it starts with, really and truly the health of our babies and our children and our teenagers starts even before they're born with our maternal and paternal health. I'm not letting dads off the hook here, right? It's not just about the moms, but the health of, mom and dad's gut microbiomes, metabolic health, blood sugar regulation, all of that can inform how healthy the start you give your baby in life. And so, from there, if we can really, before we have kids, adopt a lifestyle and a diet that is nourishing to our brains and bodies, that's going to trickle down to our kids. Now, there's been pushback from, some some online nutritionist influencers saying, oh, well, you don't want to cause orthorexia or problems with, eating disorders in kids, and you shouldn't talk about a food as being healthy or not healthy or bad or good. there are some things that we do want to share with our kids from the very beginning about not necessarily, oh, that's bad, but you know what, that's not a strong food for you. Like you want to be able to, run around with your friends at the playground without, losing steam. Well, maybe we want to choose foods that are going to keep your body and your brain super strong. And as you said, as it gets older, the goals change a little bit. A middle schooler, it might be, being able to speak in front of their class when they have their 8th grade presentation, or a high schooler, it's, the sports performance and the skin. But the more we can tie their diet and lifestyle choices and help them make informed, educated choices, and not judging when a choice is made that maybe we wouldn't want to. Because, I mean, how many times do we as parents make choices that we're like, oh my gosh, why did I do that? Right?
Yeah.
But that's part of resilience. You make that choice, it's informed, you don't have guilt over it, but then you say, okay, well, now how can I clean up so that I can enjoy this artificial blue rainbow colored thing and then mop up the effects with different choices moving forward.
Right. And, going back to like some of those conditions that you talked about that you're seeing so much more in your practice, how can an integrative approach, like how you would serve your patients in your practice, how could that benefit from a more traditional approach, just to kind of contrast that
well,
for listeners?
Let's take eczema, because that is such a common condition in kids and even adults.
I had it growing up and had no idea for a long time.
And a lot of adults still get like the itchy,
or people get like the bumps all over. Would you consider that eczema even?
That's kind of on the eczema spectrum, the keratosis pilaris, right?
Yes.
Right.
Yep.
I mean, super common. And we know that those, from a conventional standpoint, when your kids are itchy, hot, inflamed, can't sleep, okay, yes, we need to, quiet the fire so that they can be comfortable in their skin. And that might mean occasional steroid cream, but lathering every single day, again, with the effects on the adrenal glands, the systemic absorption. We know everything that gets put on the skin is absorbed through the skin. So, and a lot of parents will recognize that, okay, I can put the steroid on and their skin is clear. Now they have buttery skin, they're fine. But then 2 weeks later, it crops back up again, right? It just keeps coming back. And so if we really want to heal and not have it come back, we need to do that from the inside out. And that, I mean, the reason I wrote the book is to really impart on parents and kids and families the knowledge that when we work on optimizing your gut microbiome, that really does lay the foundation for healthy immune systems, healthy brains, healthy skin. Thinking about, eczema, let's say, root causes. It's, the microbiome is a huge root cause. And oftentimes when you optimize the gut microbiome, a lot of other things fall into place, right? We know for moms where there's a really strong family history of eczema, asthma, allergies, that kind of atopic triad. If moms were to take a probiotic called Lactobacillus rhamnosus during the 3rd trimester and while she's nursing, that can significantly reduce your baby's chance of getting eczema or asthma, right? Because of the influence of that particular probiotic on your baby's developing microbiome and shaping the 80% of their immune system that is in their gut, so that their gut immune system connection can really communicate. But that's part of the picture. It's a huge foundation. But there's rarely a time where there's just one single root cause for that's the only thing going on, right? So we also know that with eczema, there are often nutritional insufficiencies that are making it really hard for your child's skin to heal. So zinc is really important for skin healing. Many, many kids have had the opportunity to do a blood test. I'll see, wow, they need a lot of zinc. Zinc is important for any healing of whatever lining on your body, like your gut lining if you have leaky gut, or your skin lining if you have eczema or even acne, right?
Mm.
And then we also know that your omega-3s and beneficial omega-6s, so your omega-3s from fish oil, like EPA and DHA, but also a really beneficial omega-6. We often think, oh, omega-6s are bad, but it's the kind and the amount. And so there's a really beneficial omega-6 from black currant seed oil, evening primrose oil, or borage oil called GLA, gamma-linolenic acid. And those also, most kids with eczema are insufficient or deficient because their body's just using it all up. And, a fish is not necessarily, for most kids, some of their favorite foods, at least in the beginning, right? And so those are probably the two that I look at more closely. Of course, vitamin D, it's a rare child who doesn't need extra vitamin D, right? Or an adult too, for that matter, right? And vitamin D is so important for immune balance and regulation. So we look at, what is, first of all, how do we optimize the gut microbiome? We always start there. Then we look at, what are some nutrient deficiencies or insufficiencies that are slowing the healing process that we need to optimize. And then we also look at, well, what's fanning the flames? What's causing more inflammation? And with eczema, it could be psychological stress. A lot of teenagers and adults know, okay, as soon as I'm stressed about an exam, oh my gosh, my eczema flares, right? Because psychological stress can disrupt the gut microbiome and is really inflammatory. Or maybe it's a food, even some of the quote healthy foods. Like, could it be that, even organic corn is inflammatory for your child? I've had, citrus be a big factor for some kids. Gluten or dairy can be a big culprit. So it's kind of doing that detective work. Maybe it's not a particular food per se, but the ingredients, just too much added sugar that's fanning the flames in your child's gut for gut imbalances.
Do you find, I mean, I agree with everything you said, and I find it so interesting, but do you find that when you're working with kids or teens and you're sharing all of this with them, that they're just like, I don't want to deal with all that? Like, or are they coming to you to the point where their eczema is so out of control or their acne is so out of control that they are willing to do anything and try anything to get the relief?
I mean, it's probably both. I mean, for like the second scenario is usually the younger kid where they're just covered head to toe. And, oftentimes they are toddlers where as parents, we have this, we don't recognize it at the time, but we have this golden opportunity where we actually have total control over what goes on their plate, and that quickly fades as soon as they start elementary school, and the food sharing starts, and for sure by the time they're in high school. But so there is that. And then, for the older kids and even with toddlers, I talk to them in a really age appropriate way about, what's a probiotic? The trillions of tiny friends in your tummy. They're keeping your skin healthy. So how do we take care of them? And so, we start with that foundation of how do we take care of this other ecosystem within us. And then, for older kids and teenagers, I put in a little bit more of the science so that they understand why we're focusing on this. And then when they're older, it's really important to get their, I mean, of course, they're buy-in, but also, just get a sense of, well, where do they want to start? And we don't have to do everything at once. And so, if they want to start with, okay, well, I'm not really willing right now to change my diet, but, I'll take a couple of vitamins. All right. So then we'll start some zinc and, a 369 fish oil. Right. Or a probiotic, or, maybe so we kind of work with that, and see, I will say starting zinc and omegas, like the 369s at high, it has to be higher doses for often, but starting that can provide some quicker relief because you want quick little wins so that, I mean, your kids, your teenager, even you as a parent feel like, okay, I'm starting to see a little movement. I want to stick with this. I want to see what the next thing can do or the next thing.
Do you see relief, just out of curiosity, because I know a lot of our listeners have teenagers
Yeah.
and acne is
Yes.
a big
Yes.
issue. Do you see relief in acne with the same kinds of things you just went over for eczema, or would you say it's a little different?
Um, similar, but I would say with acne, I mean, the diet does play a really important role. So I talk a lot about that with kids, right? And
Mm-hmm.
then it's really up to them as preteens and teens to, again, make that knowledgeable decision. And, you know, the two, well, the one food consistently in the research that has been correlated with acne is dairy, cow's dairy. So even that, like, you
Yep.
know, little sprinkle of cheese on their sandwich, like, you know, every couple of days, that could still be an inflammatory trigger. So, and so, you know, if that's something that I talk to kids about, hey, look, why not just, you know, if you can commit 2-3 weeks, let's map out, have a plan, right? We can't just send them off, you know, to try to be dairy free. And then the next day they have a plan to go to In-N-Out with their friends. And they're like, what do I eat? I mean, we need to map out like, okay, where are the places you go to eat with your friends? Let's look at the menu. I mean, the parents can do this too, but like literally look at the menu. All right,
Mm-hmm.
instead of getting I haven't been to In-N-Out, but there's like the double thing, right? You know, like what would you choose instead, you know, without the cheese? Or if you go to Chipotle, let's figure out, like, instead of getting the cheese on your burrito bowl, you know, what else? So giving them clear, like, what are you going to choose when you go to Starbucks, right? What are you going to choose when you go to the grocery store? And so if they can really plan that out, you know, for two,
Mm-hmm.
3 weeks, they can start to see improvements in their skin. Zinc is really important. Vitamin A is really important, you know, for acne control. And the thing with, you know, with acne is, I mean, there's a few different processes that are occurring. The teenagers just make more sebum. I mean, they're greasier, right? I mean,
Mm-hmm.
they can't go like when they were toddlers without washing their hair for a week, and it still looks fine, you know, not greasy. I mean, some kids literally they shower in the morning, by the time they come home, it's like, you know, a greasy, stringy mess. And so you just have to know you're just more greasy, right? And so that means hygiene is very important because that grease is clogging your pores, trapping all the daily dirt in and bacteria in, and going to increase the likelihood that a zit is going to form, right?
Right.
So simply the act of washing your face twice a day, and I have them get, you know, at CVS, you can get like for $5 those facial brushes, the soft ones with the handle that they can just, you know, literally kind of exfoliate, not rough. I just say don't scrub, but you're trying to open the pores, and then the soap can penetrate in, clear out some of the oil in there. You don't need I mean, there are the fancy electric ones, but you don't need that, you know. And, you know, just from a mechanical standpoint, I mean, the kids who have the bangs and put a lot of product in their hair, or if they have the back knee or the back knee or the chest acne, if they're, you know, not rinsing out conditioner well and following that up with soaping their body after, that also can plug their pores, right? So there's some mechanical things, but then with acne, there's the sebum, there's the plug pores, but there's also a particular bacteria on the skin. You know, we have microbiomes all over our body, unique microbiomes. Our gut has its own microbiome. That's the one that most people know about. It's the most, you know, most well studied. But our skin has its own microbiome. As women, our breast milk glands have their own microbiome. Our vaginas have our own microbiome. Our hearts have our own microbiome. I mean, it's fascinating. But there's a particular bacteria that can, you know, kind of um, uh, can grow in larger numbers. It used to be called, it's a long word, Propionibacterium acnes or P. acnes. Now it's Cutibacterium acnes or C. acnes. And so there's that particular bacteria. And there are now certain like probiotic skin washes that can balance out the
Mm-hmm.
microbiome on your face. There's one, I don't, you know, have any what's the right word? No affiliations with this
Affiliation.
company. Yeah. But there's a company called Phyla Biotics.
Yep.
Oh,
We had them
right?
on our
interviewed the
podcast.
founder,
Yeah,
the
yeah.
co-founder.
So
Yeah.
there, I mean, that it's a fascinating concept, right? And
Uh-huh.
I've started using it, and I'm just recently, and because of hearing good reports from my pediatric colleagues, and so that uses they've identified this phage, this virus. So it is a kind of a probiotic that is that can specifically target, and phage in Latin is to eat, right? So specifically eat up, get rid of the bacteria that causes acne without disrupting the rest of your skin microbiome, which also is key. I mean, kind of like, antibiotics, when we take them for an ear infection, it wipes out not just the bad stuff, but also the good stuff. If we're using a lot of antibacterial face washes, that may help the acne, but then we have to think, well, how do we restore your healthy skin microbiome so that you're left with not just acne-free skin, but acne-free healthy skin, right?
Yeah. And so you've talked quite a bit about gut. And maybe we could talk a little bit about the relationship between the gut microbiome a little bit more and some of the chronic childhood diseases.
Yeah.
So in addition to acne and skin, which is obviously really important,
Yep.
but you're seeing a lot more than that.
A lot, yeah.
And you talk about this in the book, and we'll dive into that in a minute too.
Yeah. Well, so, the main things I mean, everything is developing in their systems, right? I mean, they're kind of this blank slate, and they have the genes that they bring with them, thanks to us, right? Their parents, but their genes don't set their health history in stone. We know that, from epigenetics. But we do know that disruption to their gut microbiomes in infancy and really any point in life, but especially in those younger years, can influence the gut immune system development, gut-brain connection. So, for instance, with antibiotics, we know antibiotics, like I mentioned, that's they disrupt the gut microbiome instantly. There are also other medications like antacid medications that can do that as well. And so this one study that looked at, infants who had received antibiotics or antacid medications in the first 6 months of life were significantly at increased risk, sometimes double the risk of virtually every single allergic disorder. So eczema, asthma, hay fever, hives, anaphylactic food allergies, which when I was in med school and residency, there was hardly a child with anaphylactic food allergies. And now we have more and more children, and more adults are developing anaphylactic food allergies later on in life. So, and we can see that now. What is some of the mechanism behind it? If you want to get into the nitty gritty, a lot of it, probably has to do with the loss of a very important, entire species of bacteria, the bifidobacteria in our babies' guts, because bifidobacteria is really important for developing immune tolerance, right? Living in our world, being able to tolerate all these things that come our way without creating tons of inflammation. And so, our children are losing that. Even us as adults, we're losing that. Bifidobacteria is so important. And a baby's gut microbiome looks very different from an adult microbiome, until about maybe 4 years of age. So at birth, in that early infancy stage, babies should have almost 80% or more of bifidobacteria. You don't want a lot of gut microbiome diversity, right? As opposed to adults, we want a lot of diversity. So it's flipped. So in adults, we might see maybe 12% bifidobacteria. But even then, so many don't have enough. From a mental health standpoint, we know that how the gut microbiome develops and shapes informs how their brain is developing and shaping. Our microbiome is responsible for the vast majority of, producing the vast majority of many of our neurotransmitters, which are gut chemicals like serotonin that helps us feel calm and happy, manage anxiety, helps us fall asleep. Dopamine, which is our attention, reward, focus. GABA, which is a calming neurotransmitter. Acetylcholine, which is really important for processing. We can see that in Alzheimer's patients, acetylcholine, can be a problem. And melatonin. Our gut makes over 400 times the melatonin than our brain does. But we can only have healthy levels of neurotransmitters if our gut microbes are healthy. So another big study out of Denmark looked at mother-infant pairs and looked at antibiotic exposure. So even antibiotic exposure in utero, right? Because the antibiotics we take for a UTI or sinus infection when we're pregnant, that can still affect the baby's developing microbiome. And found that, even just one round of antibiotic exposure in childhood increased the risk of, virtually all mental health conditions that they looked at.
Wow.
Yeah. The younger, the risk was highest if those antibiotics were given before 6 months of age. And the more rounds, the higher the risk. Now, we know this in adult medicine. We've seen adults have a higher risk of depression, anxiety, mental health concerns after antibiotics. But now we know, okay, in infancy, because of how the gut microbiome informs how the brain develops, it's a really key time. And it's not to say, I always tell a stop at this point and let people know, look, my kids both had antibiotics when they were under 5 weeks of age. They were absolutely necessary. And I wouldn't, did I not want to give them? Of course I didn't want to give them, but I knew they were necessary. I was fortunate enough to know, how to kind of clean up their microbiome. But even if you didn't know at that time, you can still, as you said, Marnie, it's never too late, right? It's never too late, but it's just the knowing if your child is presenting with, ADHD symptoms when they're 6, all right, let's look at their gut. Even if they have perfect poops, right? You still have to look at their gut.
So would you say that most of your work for all these different things that can go wrong, I'm not talking about, illnesses where you need to be in the hospital and things like that, but, ADHD, acne, we touched on depression, what
Even
else?
cold and flu, like chronic colds and flus and things like that.
Would you say that cleaning up the gut resolves most of these issues?
It absolutely can, or at least get you a lot of the way there. So, I
think that's important for our listeners to hear. So that's why I just want to reiterate
it's really,
that.
Yeah, I've had kids who, come in, they're getting ear infection after ear infection, sick after sick, and, just cleaning up the gut. And all of a sudden, the next winter, they're like, wow, okay, I get some colds here and there, but it doesn't lead into this constant all winter long needing antibiotics. Or, kids with, this is a little bit more of a dramatic case, but, I had 2 siblings with autoimmune juvenile arthritis, and one had rheumatoid arthritis and Crohn's disease. And, it's never not that it's never simple. It's a journey, right? Any healing journey, you're going to have ups and you slide back a little bit and then you go up. And so, I don't want to paint a picture of, we clean up the gut and boom, next day your child doesn't have their chronic thing going on. But, for these kiddos, the final piece in their healing and remission, cleaning up their gut and getting rid of a particular bacteria called Klebsiella. And that was the switch that led them to ultimate healing. So it can absolutely be, that profound. And that's why, I so believe when we start with the gut, we start there, and then we might still have to do some other, cleanup, but that's a primary, and, so many things will fall into place then.
So I know I feel like we could have you back on for a part 2, but we do want to dive in and talk a little bit about your book, Healthy Kids, Happy Kids, an Integrative Pediatrician's Guide to Whole Child Resilience, which it's funny because when I first started out as a health coach, I developed a workshop and it was called Healthy Kids, Happy Kids.
Oh, nice.
So yeah, this is just something
it's meant to be.
I know, right? I was like, wow. And I feel like this is a guide that every parent, regardless of the age of your children or anyone who's thinking of becoming pregnant, needs to have.
Or your kids are going to have kids, right?
Yes. Exactly. Anyone you know around you, that's right.
Yeah.
And because it's so comprehensive, it's very easy to follow and understand. You have so many practical solutions, just the way it's laid out by chapter. It's a resource book, in addition to being informative and science-backed. So I just love that approach that you've taken with it. Can you just dive in and talk a little bit more about the book and maybe like your gut reset, some of those practical tips that you share in there that would be helpful regardless of where you're at, the age of your kids. You even talk about like essential oils and you have like acupuncture points in there. You have it all. It's so comprehensive.
Yeah. Well, thank you. So the book is divided into 4 main sections. And like you said, you can kind of flip back and forth. Part 1 is really the foundations. It's just to understand, some of the research behind the gut microbiome and your child's immune, brain, metabolic health. And so, even for functional medicine practitioners who have been doing, this work for years have told me that there's so much information that they actually hadn't known. And that really kind of reconfirms their commitment to working on gut health, especially at very, very young ages. Really important. Part 2 is the foundation. Part 2 is where, we set that stage for microbiome magic. And it's the part that, I recommend just going back to over and over again. Because there are parts, I don't know about most people. I think most people have this like I do, where I'll read something and say, oh, that was really good. And then I'll read it again. I'm like, oh, I didn't catch this part. You get a new pearl every single time. And I make it super practical, easy, and doable for kids and families and teenagers. And so that's the part where actually there was a kid, he was a senior in high school, heading off really, focused on sports and athletics. And so, he read the part about added sugars. Yeah, like mom just kind of mentioned it, laid it out, and he read that part and it clicked for him. And he's like, oh, okay, I'm going to start thinking about now paying attention to how much added sugar I actually have on any given day. Because if we don't pay attention to it, it can slip through, and all of a sudden we're having, way more than, the 25 grams of added sugar in a day. Not to be obsessive about it, but just to recognize that, what, on average, teenage kids kids in general, 2 to 18, no more than 25 grams of added sugar, which is the equivalent of about 6 teaspoons of added sugar. Okay, 6 teaspoons. You think, oh, my kids aren't having 6 teaspoons. Well, guess what? That Dave's Killer multi-grain seeded bread that you're making your peanut butter and jelly sandwich on, one slice has almost a teaspoon. So you have 2 slices. That's 2 teaspoons,
which is
right
crazy.
there.
In your bread, you don't need all
in
that
your bread.
sugar.
That's right. Which is, and also I point that out because that was the bread I used to buy, because I'm like, multi-seed, whole grain. Look at all the
it's organic too.
That's
so
right,
think,
organic. And then you're like, oh my gosh, a teaspoon per slice. That's
right.
You don't need that. And so, just in recognizing that, our teenagers now, they should be having no more than 6 teaspoons. The average teenager is having somewhere around 34 teaspoons a day.
Well, and just think about the Starbucks drinks, right?
Yeah. The Starbucks drinks, like, let's say,
that's such a trend right now.
That's right. There's like, the typical, like your kind of average, mocha frappuccino thing has about 8 teaspoons. But there is a drink. I remember looking through my Starbucks app. There is a drink that has like 12 teaspoons. Right?
Wow.
And I think there was even one that I saw that had like 15 teaspoons. It was
like the crazy. Shamrock or like one of those
something like those secret drinks, right?
Yeah.
So it's just being mindful and aware. And so making so he started just making different choices, and he still went out and got Starbucks or boba with his friends, but it was every once in a while. It wasn't every day after practice, right? And then he could notice a difference in his lean muscle mass and energy and performance.
Well, that's the key. When they're old enough to start feeling and recognizing the effects of the food, and then you don't go down the like orthorexia kind of route that you talked about earlier, where people are like fearful of it. It's like, I'm making this choice because I feel better, I perform better in sports or school or whatever it is.
Yeah.
And so it's that awareness and tuning into their body that eventually will come with age and with just like awareness, I guess.
It does.
Yeah.
We have to trust that it will come because it does.
Mhm.
And that's how you keep adults on that path, right? So
Right.
that's part 2. And in part 2, I really dive into the 5 things that we already do every single day. But if we think about them mindfully and do those things like a gut hero,
Mhm.
then we can really support our microbiome with all it's in how we eat, how we nourish and eat, how we breathe or practice mindfulness, how we move our bodies, how we sleep, how we hydrate. So I created this idea of these 5 things for microbiome magic so that kids and parents don't have to feel like I have to do one more thing. It's just,
Mhm.
no, we have to eat every day. Why don't we
Yeah.
eat in a way that actually takes care of our microbiome? I have to sleep every day. Let's think about not just sleep for me, but sleep for my microbiome, because my microbiome's really one of their sole jobs is to keep us healthy and happy. And so super practical tips in there. I had one mom, there's a little tip to get in like a little bit more fiber or vegetables or microbiome champions by making your meal pop with plants on purpose. So just talking with your kids, how do we make it pop? Like, okay, great, you're having oatmeal, with some raisins on it. Hey, could we make it pop by adding maybe like a few pumpkin seeds on there, or making it pop with, some hemp seeds, or maybe fresh blueberries too. So just making it pop with just a little bit more. It doesn't have to be a huge step. And a mom, was listening to something I was teaching with her 4-year-old, and her 4-year-old that night came. She was making dinner. She's like, "Mom, are we going to make it pop?" And then right, and then even the next morning, she asked her dad, as her dad was making breakfast, like, "How are we making this pop?" And so it kind of stood out, right? So
Yeah.
that, I mean, it's got to be fun and it's got to be doable. Otherwise, it's just not going to last. And then part 3 is really for a lot of the listeners, where they're going to want to look at more closely on what happens when something goes wrong. If your gut microbiome is disrupted, how do we heal? Think about healing a leaky gut in kids. How do we think about restoring microbiome balance in our kids with the gut reset? Now, the gut reset is really what I'm calling the gut reset, the healing plan. It's still, the RE is still returning to the 5 things for microbiome magic. This is not just about, taking a whole bunch of supplements, and maybe some different medications, eliminating some foods, and then poof, everything's healed. You have to have the foundations there. So that's really important. But then there's different strategies on, how to think about sealing and healing your child's leaky gut, eliminating gut dysbiosis, and transforming the microbiome so we have lasting healing.
Yeah.
And then part 4 that's more like the bedside, like just keep it there, especially with young kids who are getting fevers, earaches, sore throats, tummy bugs. And just my approach to when kids are sick from an integrated pediatric standpoint, what are some of the diet and lifestyle factors that we really want to pay attention to? What are the top protocols with acupressure points, herbs, homeopathic medicines, essential oils that I use? Like, if you were my patient calling me in the middle of the night, Johnny's starting to throw up, what do I do? This is exactly what I would tell you. And then also I want parents to know when it's time to go see the doctor. So important, when should you call the doctor? When is it time to think about going to the ER or urgent care? And, when might antibiotics be appropriate? And if they are, how do you mop up, the unintended damage from that?
Which is all so important, right? Because you need the whole package.
Yep. Yeah.
Yes.
So I know we're running out of time, and we will link up in the show notes where our listeners can find you and buy your book. And one question we love to ask all of our guests is, what does the art of living well mean to you?
The art of living well means to me being always in tune with how regulated my nervous system is. I think that, if we as parents can, be in a state where our nervous systems are regulated, then we can co-regulate with our kids and just have this ripple effect of, okay, let's be, more calm and regulated, which then has those ripple effects on not just our brain, but also our immune health and our gut health. So I think that, we can't get rid of stress in our lives, and nor do we want to, right? But if we can regulate ourselves, we can manage that so much better. So that, to me, that's a lifelong quest for me. And also,
For all
something,
of us, I think.
something I want to impart, make sure that I impart to my kids too.
I felt like you were speaking to me on that. I was like, wow.
Yeah.
I mean, because it's something that I'm on a constant journey as well. And
Mhm.
like you said, it has this ripple effect.
Yep.
Yeah.
Our kids absorb everything we do when they're around us 24/7, especially when they're young, including our stress response. So
Yes.
Even when they're not young.
well,
I feel like they're
probably
always
even
watching
more when they're
us.
older. Then they call me out on it, which is good. Then they're recognizing it. So
Yeah, it's true. I mean, when you come in from, a day of like frenzy, and you're like, even if you haven't said a word, your kids start to act more frenzied, right? Like, I mean, you can tell, and that
Energy.
co-regulation is just so important.
Yeah.
Absolutely.
Oh,
So
wow.
the book is Healthy Kids, Happy Kids. Look it up, go buy it. We recommend it for everybody.
Yeah.
You can see it right there on YouTube.
Yep.
Really nice, bright yellow cover.
Thank you so much, Dr. Lisa. This was wonderful. And yeah, you have a lot to share with everyone. And I will just say, while this is focused on kids, because that's your specialty, I found everything in here 100% applicable to adults as well. And just even, Marnie and I as health coaches,
Me too.
all these things in here I work on with my clients who are, 20 to 60. And so to have this information at an earlier age for your kids is, you're giving them such a gift. Really,
And
you're not
such a
depriving them of
foundation.
something. You're not depriving them of the juice or the sugar or whatever at the party. You're giving them a gift of a happy and healthy life. So
I love that.
Yeah.
Thank you.
All right. Have a wonderful day.
Thank you so much.